Hello. Advocate Aurora Health and Advocate Good Samaritan Hospital are pleased to welcome you today. I'm Bill Rhodes, the Chief Medical Officer here at Advocate Good Samaritan Hospital. Special welcome to Governor Pritzker and the American Red Cross for coming together today to pay attention to this important healthcare need of blood transfusions here in the state of Illinois. Thank you, Governor, for your incredible leadership in the COVID pandemic. I'm happy to announce that today at Good Samaritan we have 0 COVID patients in our hospital. And this is demonstrating the great progress we've made with the effectiveness of vaccines. I encourage everyone, if you're not vaccinated, please get your vaccine. Today we're going to cover 2 important concerns in our state. First, an urgent need nationwide for blood donations. And I want to thank all of the policy leaders here today, Majority Leader Greg Harris, Senator Maddie Hunter, Senator Ann Gillespie, Senator Susie Glowiak-Hilton, Stephanie Altman with the Shriver Center, and Timothy Jackson with the AIDS Foundation. They've all joined us today to mark this important legislative achievement in signing the Medicaid omnibus bill, which makes important changes to strengthen our care delivery in our state and advance our journey toward health equity. Before I welcome those speakers to the podium, I wanted to point out the need for blood transfusions or blood donations. A wide array of patients here at Advocate Aurora Health need blood transfusions, surgeries, cancer treatment, traumatic injuries. As the only level 1 trauma center here in Illinois, Good Samaritan is in DuPage County, not in Illinois. Good Samaritan is, we see the daily impact of blood transfusion saving lives. The American Red Cross is currently experiencing a severe nationwide blood shortage, and this increase is due to increased visits to emergency departments. We've seen a blood usage going up by about 10% across the nation. Because Advocate Aurora Health encompasses 5 level 1 trauma centers plus teaching hospitals, stem cell programs, transplant surgeries, and high-risk obstetrics, our patients often need blood transfusions during care. Health systems and hospitals like ours partner with programs like the American Red Cross for blood transfusions, and it is a crucial part of patient care. Just outside this room, we are adding 50 units to the blood supply today in a blood donation program here at Good Samaritan Hospital. Without further ado, let me welcome to the podium Governor Pritzker.
Thank you, Dr. Rhodes. Thank you. Well, thank you very much, Dr. Rhodes. Thanks for that very kind introduction, and also for your work and the work of all of the folks who work in the Advocate Network. Because what you do every day saves lives and improves health for Illinois. I also want to thank you for partnering with the Red Cross today to host a blood drive with blood supplies across the nation and here in Illinois at critically low levels. Now is the time for our fellow Illinoisans to help out. The holiday weekend may be over, but one of the most patriotic things that you can do year-round, if you're healthy and able, is to donate blood to those who are in critical need. To find a location, it's very easy to donate blood. Visit the American Red Cross website, enter your zip code under Find a Drive. It doesn't affect the quality of your immune system. It's safe, and it very well could save a life, maybe even your own. I'm here today to emphasize the importance of having a healthcare system that serves everyone, no matter their circumstances, their skin color, their zip code, their language. Today, I'm signing into law legislation that makes healthcare more accessible and affordable for all Illinoisans. And I want to thank Senator Susie Glowiak-Hilton for welcoming us to her district. She's been a great colleague working together in Springfield to get big things done. I also have with me today Leader Greg Harris, who's been mentioned, Senator Ann Gillespie, of course, and Leader Maddie Hunter, all of whom championed the Medicaid omnibus bill aimed at making our healthcare system more equitable. A great deal of gratitude is owed to the many advocates who came together to send this bill to my desk. And here with us today, representing the advocacy community, are two of its leaders, Stephanie Altman with the Shriver Center and Tim Jackson with the AIDS Foundation. I should say Timothy, I learned back in the room before we came here. So this legislation that I'm signing into law today is a product of our passionately dedicated, bipartisan, bicameral group of legislators who are part of the Medicaid Legislative Working Group. Now, I want to pause on that just for a moment to highlight it, because for all the naysayers that always seem to bad talk the state of Illinois, few other states can say that they have an annual commitment shared across both sides of the aisle to hash out how to make health care access for millions of Illinoisans who rely on Medicaid even better. And this year, once again, they've done it. This legislation provides Medicaid coverage for whole health programs, veteran support specialists, so our heroes receive care that recognizes their unique struggles, individual and group programs for those seeking help ending their tobacco addiction, and an expansion of mental health resources through the addition of clinical professional counselors. In recognition of the pandemic that we continue to live in, this legislation also expands emergency Medicaid coverage for many months to come. There were a number of people who weren't yet qualified for Medicaid. We expanded their ability to get qualified during the pandemic, so they're on Medicaid now. This expands that. The many Illinoisans who suddenly found themselves in need of Medicaid coverage in the face of COVID-19 now won't find the rug pulled out from under them just because our lives are starting to feel a bit more normal. This new law also requires that inpatient status be given to anyone in need experiencing an opioid overdose, ensuring that lower income residents aren't turned away when they need it most. And thanks to the advocacy of the Latino Caucus, this legislation builds on our nation-leading efforts to ensure the health of undocumented people through new coverage of kidney transplant medications, regardless of residency. Healthcare is a human right. Here in Illinois, we won't stop until everyone can access all aspects of it. Thanks to the legislation that's soon to be law, we are one step closer to that reality today. Now I'm very happy, pleased to turn this podium over to Joy Squire with the American Red Cross. And I just want to say the American Red Cross, we've heard their name frequently over the last couple of weeks because we've had fires and challenges of people being put out of their homes because of evacuation orders. And the American Red Cross has been at each one of those situations. They are there to help people, to feed them, to help them find shelter, to do what we all know the American Red Cross does so very, very well. So with that said, thank you very much to the American Red Cross for holding this drive today, and I want to welcome Joy to the podium.
Thank you, Governor Pritzker. It's a pleasure to be here, and thank you to Dr. Rhodes. The Red Cross is proud of our partnership with Advocate Healthcare and proud to be here today. Every 2 seconds, someone in the U.S. needs blood. The Red Cross must collect 40% of the nation's blood supply for surgery patients, accident victims, those going under cancer treatment, people with blood diseases such as sickle cell, and for those who experience trauma. We are grateful for those like the people that came out today to donate. You are giving life-saving blood to patients. But we are in need of more people to donate as we face a severe national blood shortage after the holiday weekend and as we move into the peak of summer. While summer is traditionally a time when blood donations do decline, this year is particularly challenging as many Americans receive their vaccinations, resume summer activities, and after more than a year of limited interactions are doing what's fun and what we all want to do, but it's leading to lower turnout. The need for blood doesn't take a summer break. Patients still depend on those life-saving transfusions. The Red Cross must continue to hold blood drives across Illinois and across the country, supplying hospitals with life-saving blood. It's estimated that approximately 38% of the population can donate blood, but yet only about 3% do. Healthy donors of all blood types, particularly type O, are needed to schedule an appointment in the days, weeks, and months to come. Blood has a shelf life and cannot be stockpiled. The need for blood is constant. You can make an appointment to donate by visiting redcrossblood.org or by calling 1-800-RED-CROSS. Two of the most important things you can do for your community are rolling up a sleeve to give blood or by becoming a Red Cross volunteer. Thank you to every person who answers the call. You are making a difference this summer and could be saving someone's life. And now I would like to introduce Majority Leader Harris. Thank you.
So thanks, Joy, and as Governor Pritzker said, thanks to everyone in the Red Cross for being there for our communities, for trauma, for disasters, for feeding people after fires, and all the work you do. As Governor Pritzker said, we're here today for him to sign the healthcare and Medicaid omnibus for this year. It's something we in the legislature do every year to improve healthcare for people in every corner of the state of Illinois. But this will be really the first post-COVID omnibus bill. And in this, we've learned a lot of lessons from the last year about inequities and disparities in communities hardest hit by COVID. Many of these are covered by Illinois Medicaid. Some of these folks were not covered at all. So today is a step, one of many steps, to expand coverage and access, to make it more user-friendly and reduce disparities for people to get health care. We've already signed this year, the governor did, the Black Caucus healthcare pillar. There will be future bill signings for telehealth, for laws restricting insurance companies from using prior authorization to reduce access to health care, and to bring down the cost of prescription drugs. We've been working on this, every chamber, Senate and House, and the governor's office, through the pandemic to roll out this package this year. As the governor said, and he highlighted some things in the bill, I just wanted to mention a couple others. It establishes a new section of behavioral health providers, community behavioral health clinics, that will be spread throughout the state of Illinois. These are going to be funded through federal funds. We're going to make a number of changes in the law to make it easier for people seeking substance abuse treatment to be admitted to the hospital, and it requires insurers to pay properly according to ASAM guidelines. It will expand the ability of the Medicaid program to pay marriage and family therapists for the first time. It will allow Medicaid to pay for long-lasting injectable mental health and substance abuse drugs. It will add coverage of chiropractic services. It expands access to smoking cessation programs and anti-smoking drugs. And as the governor said, it adds community-based services for both veterans and also for seniors who want to stay in their homes as long as they can and avoid going into a nursing home. It does things like, it may seem small to some of us, but it's huge to those for whom it matters. We're cutting a lot of the red tape for people in complex rehab technology situations. Think of complex wheelchairs. Right now, just getting a wheelchair fixed, if there's a wheel problem, if there's a mechanical problem, involves a lot of red tape, and somebody can be out of a job or unable to take care of their family for weeks, if not months. And we've eliminated a lot of those prior authorization requirements and taking steps to make that easier for folks with disabilities. So this is just part of an effort to re-envision healthcare, to tear down barriers, to make access easier, to make healthcare more affordable and more comprehensive for everyone in the state of Illinois. And to do something like this, it takes a really great partner, and I'm lucky to have one who leads this effort for the Illinois Senate. Senator Ann Gillespie, a lifelong healthcare expert, and somebody, who has helped bring that chamber along and work with us on this and, all other healthcare bills. So, Senator Gillespie.
Thank you, Leader Harris and Governor. for your ongoing support in this area. Leader Harris and the governor both talked through some of the specifics in the bill. What I'd like to point out is how it works together with another piece of major legislation we did in January, which is healthcare transformation and the funding of projects to look at ways that we can expand, improve, do new things, do things differently in Medicaid by bringing community organizations together with healthcare providers and making it collaborative. And we just awarded the first round of funding for those programs. It's going to be a 3-year effort of $150 million investment each year. Happy to say Advocate is one of the partners in one of the programs, so kudos to Advocate for getting involved in that. And it's really bringing the community to the forefront of saying, this is what we need in healthcare, this is why we want to deliver it, this is how you can best help us, and bringing them together with both the state and the healthcare community to try to do Medicaid a little bit differently going forward. This bill that we're signing today expands that in the community behavioral health care clinics, for example, modeled as federally qualified health care centers, but focusing on mental health issues. This is a new innovative way that is showing real promise in getting reaching out to community members that aren't reaching out themselves to get mental health as readily. And the thing that I also really like about the way we do Medicaid in this state, and I want to thank the governor and his team, particularly Director Teresa Eagleson for it, is that we go out of our way to find ways to expand federal match dollars with every new innovation we bring to the Medicaid program. Illinois is one of those states that's a donor state. We give more to the federal government in our tax dollars than we get back in programs. But in the Medicaid program, through the governor and Director Eagleson's leadership, we have worked very hard to ensure that we get those federal match dollars that make the program go further to treat everybody in the state. And I want to thank the General Assembly, the Medicaid Working Group colleagues for making Medicaid and for always supporting Medicaid as our primary tool to get health care services to those who are most in need. And now I'd like to thank or ask Stephanie Altman to come to the podium.
Thank you to the Red Cross and to Advocate for inviting us here today and the Governor's Office. The Shriver Center on Poverty Law, where I work, believes that everyone deserves access to affordable, comprehensive health care, no matter their income, race, gender, or where they're from. And I know those values are shared by the legislators behind me and by the Governor. People need to stay healthy so they can work, take care of their families, and be active members of their communities. On behalf of the communities we serve, we commend the legislature and thank the governor for the passage and signing of this important piece of legislation, which guarantees continued healthcare coverage without cost-sharing or premiums for low-income families in Illinois for the duration of the current public health emergency. This provision will guarantee that these families experiencing both economic hardship due to the ongoing COVID-19 pandemic will be able to keep their Medicaid health insurance regardless of changes in their income and employment and get the care that they need to stay healthy. This legislation will also make healthcare coverage for children under the All Kids or CHIP program guaranteed under Medicaid without monthly premiums and reduce the harmful churning on and off of healthcare coverage permanently in Illinois. As you've heard today, Illinois is once again leading the nation in providing healthcare for all and responding to the COVID-19 crisis with compassion and care for overburdened families in our state. And it's now my privilege to introduce my Protect Our Care Illinois colleague, Timothy Jackson, who is the Director of Government Relations at the AIDS Foundation of Chicago. Thank you.
Thank you so much, Stephanie, for that warm introduction, Governor Pritzker. As she mentioned, my name is Timothy Jackson. I'm here representing AIDS Foundation Chicago, but more importantly, people living with the vulnerable to HIV here in Illinois. Senate Bill 2294 is a major win for the state's Medicaid program and for the most vulnerable communities across our state. As we've seen with the COVID-19 pandemic, access to health care is paramount. That is also true for people living with HIV. And that is because 3 out of every 5 people living with HIV in Illinois receive their health care through the Medicaid program. While there are a number of reforms included in this legislation worth mentioning, I did want to highlight one involving smoking cessation. Senate Bill 2294 extends Medicaid coverage for all tobacco cessation medications and counseling services. You see, smoking is especially dangerous for people living with HIV. For people living with HIV taking treatment with an undetectable viral load, smoking has a much greater impact on life expectancy than the HIV itself. Smoking can shorten the life expectancy of a person living with HIV by an average of 6 years, and it doubles the risk of death for people living with HIV who are taking HIV treatment. This bill goes a long way also in assisting us to fulfill the goals and priorities of the Getting to Zero Illinois 2030 plan to end HIV. And so we understand that this is just very common sense, bipartisan, bicameral legislation to help the most vulnerable in our communities. And so with that, thank you so much for allowing me to speak. And with that, I will bring Governor Pritzker back up for the bill signing.
Thank you very much, Timothy. And now for what you've all been waiting for. Happy to take any questions from members of the media, although may I just take one moment to say I did not get a chance to recognize the director of the DuPage County Public Health Department, Karen Ayala, who throughout this pandemic has been just a stellar partner and leads, of course, the public health department of the second largest, or at least most populous, county in the state of Illinois. And so you can't manage statewide health care and public health without having a great partner in a very large populated county. And so I just wanted to express my gratitude to you. Thank you. Happy to take questions. Yes, ma'am. Hi, Lauren.
About the fact that, Dr. Rhodes mentioned there were 0 coronavirus cases here at the hospital today. Obviously, that's a milestone that we've been waiting for in
Yes, it is.
across the state of Illinois. What about, how do you feel about that and your reaction to the Delta variant still making headlines? Are there concerns that this could change, go back the other direction?
So let me first acknowledge that I think we all are very, very pleased that our infection rate in the state of Illinois is way down. The number of cases, the number of hospitalizations, the number of deaths, way, way down. And I think, that's owed to great public health departments across the state, to the Illinois Department of Public Health, but also to the people of Illinois who have followed the mitigations so well and wisely. And then I can't leave out the fact that the vaccines have done the work. Thank God for the vaccines. Thank the researchers and the doctors who worked through that and have done so much to protect all of us. And it gives me an opportunity to say we need everybody to get vaccinated. Saying that getting 70% of our adult population vaccinated is a big milestone, but it's not enough. And we're still, we have second vaccinations that people need to get. We have people who haven't gone yet for a vaccination. If you're hesitant, please learn more. There are plenty of places you can do that. Ask your own doctor. We've now made vaccine available at everybody's physician, their regular physician's offices. They have it available to you. So please reach out to them if you have questions and go get vaccinated. The Delta variant is, as you know, rising among the cases that are detected across the nation. We've seen it more so in other states than here. We're not immune in Illinois. Just because it's a high number in California doesn't mean that it's not coming to Illinois. We have it here already, but not in extraordinarily high numbers yet. The Delta variant gets people sicker faster. And that's very disconcerting. But let's be honest, if you're vaccinated, you're very well protected. We've seen that vaccines keep people from being hospitalized and keep them from dying. And so even if someone who had been vaccinated gets coronavirus now, they're very unlikely to end up hospitalized and nearly, I should say very, very unlikely to die. So people should be careful. I've said before that carrying a mask with you everywhere you go, if you're going to enter a large crowd of some sort, and you don't know if people are vaccinated or not. Some people who are not vaccinated are not following the CDC guidelines and wearing a mask themselves, so you may want to protect yourself, and I would suggest that that's probably your best course of action. Yes.
Hi, Governor. Marty Peck with the Daily
Hi,
Mail.
Marnie.
Hi, could you
I haven't seen you in person for quite some time. It's good to see you. Yes.
Can you just talk about President Biden's visit tomorrow? It's his first visit to the state.
Sure.
What's the impact going to be, and why do you think he chose McHenry?
Well, I'm very excited about President Biden coming to Illinois. I think that he is looking, of course, to talk more about the American Families Plan, something that will be very important for people in Illinois. So many of the aspects of that plan are really about lifting up middle-class families, working-class families, people who really need help. And so I'm an advocate for it, and I look forward to talking to him about that. I know he'll also be talking about the infrastructure plan. And that will be a big victory for us here in Illinois. We passed an infrastructure bill 2 years ago in Illinois, and as a result of that, the federal infrastructure bill, when it passes, if it passes, when it passes, means that we will be shovel ready with our matching funds in order to take advantage of the federal dollars that will come from an infrastructure bill. So I'm excited about his coming, and I know that he wanted to go to one of the collar counties to visit suburban communities. So I'm glad that he'll do that, and I'm glad I'll be there with him.
Unrelated, we've been hearing from a lot of readers who've been getting these scam emails from purporting to be, IDOT and the Secretary of State. People who, email me that they clicked on them or they don't know what to do.
Yeah.
Is there an organized effort with law enforcement to?
There's an organized effort to communicate to the public about these phishing emails, PHISH, phishing emails. These are dangerous for everybody. I think we've all experienced an email, receiving a phishing email, one that you're wondering, why did I get this? There's a link in it that they implore you to click on the link. Don't do it. If you don't recognize who's sending you that, and you can actually look at the email address that it's being sent from and get some confidence about where it's coming from, either from the Secretary of State's office, the IDOT, but lately they're not sending emails out. So you should look at it and make sure, does it say Secretary of State's office or IDOT? It probably does not. And so you should be extra careful when you receive those, and especially when you receive something out of the blue that just looks like, why am I receiving this?
All right, anything else?
Thank you, everyone.